Hi, welcome to the Glover Crafts Simulation Center at the Wegman School of Nursing. My name is Joanne Weinscheider, and I'm the Director of Simulation and Learning Resources here at the School of Nursing. Today, we'd like to talk to you about reviewing the nursing process and overview of our learning environment here in the Simulation Center. As a team, we are vested to seeing you successfully move through the 4 semesters here at the Wegman School of Nursing, while paying critical attention to your skill development, as well as your teamwork and communication. We are here to support you. Our goal is to co-create a learning experience that will help you transition into the wonderful world of nursing.
This is Crystal Dilbury to talk about the nursing process. The first A stands for assessment. That is the objective and subjective data that you collect from the patient. Subjective data is what the patient is telling you, so things like pain, nausea, trouble breathing. Objective are the data points that you collect, so vital signs, your head-to-toe assessment, but also other things like what is the patient's I&O, what do their labs look like, what's their past medical history, what are the social or behavioral cues that you're seeing, what are the things that you see in the environment, and what are safety issues that you're seeing in the environment. The D in ADPI stands for diagnosis. Now, this is a nursing diagnosis, not a medical diagnosis. And what we're usually focused on is something that is problem focused. So that's where you see ineffective or impaired something as evidenced by related to something else. So, for example, if your patient has trouble breathing, your nursing diagnosis may be impaired gas exchange as evidenced by increased respiratory rate, decreased oxygen saturation, and wheezes. The P in ADPI stands for plan. So all of the data we collected in our assessment, in our nursing diagnosis, we have to decide what are the problems that need to be addressed. And this is where we need to prioritize. So ABCs, airway, breathing, circulation, that always comes first. And then we look at the other problems and decide what comes next. The I in ADPI stands for implementation. So these are things that you have at your disposal to help your patient. And we call that the nursing toolbox. Within the nursing toolbox, you have your nursing interventions, you have your medications, what you find in your MAR, you have other orders you may find in your chart, and you have oxygen and BLS always at your disposal. So for example, if you have a patient who has trouble breathing, you can sit them up when you go into the room. You can treat them with whatever medication you may find in the MAR. And if they need to have O2, you can apply O2 and then get an order later. But what if you've gone through everything in your nursing toolbox and you know that there's still something else that your patient needs? Well, then you need to notify your provider. And the way that we notify the provider is, remember, through team steps, the SBAR, which stands for Situation, Background, Assessment, and Recommendation. And this is a way of getting a concise report to the provider and getting something else ordered or some other advice or some other discussion to help your patient. The final letter of ADPI, E, stands for evaluation. And this is where we see the effectiveness of our interventions. We're reassessing the patient, adjusting, and repeating the ADPI cycle as we need to care for the patient.
I'm Karen Parker, and I'm going to talk about our learning environment. In order to co-create an active learning environment with us, we ask that you suspend disbelief, meaning that you behave as if the simulated scenario is as real as much as possible. We're here to support your development as a professional nurse, and we want to team with you to identify your strengths and weaknesses so that together we can prepare you for real-world experiences in nursing. While we expect that you have prepared for your simulation as much as possible, we want you to feel that Sim is a safe place to ask questions and to take risks and make mistakes. We want to partner with you to ensure that this space is a safe one for learning. We don't expect that you will do everything perfectly in simulation, and we owe it to you to provide feedback that is supportive and professional. As a way to strengthen your nursing foundation, we have set aside time to work one-on-one with students in the LRC where you receive the support you need to reinforce your skills. We also encourage you to ask questions, especially during debriefing. This is the time and place for questions, and chances are someone else is wondering the same thing you are. At the beginning of your sim, we will set goals along with you for the simulation. You will meet your facilitator shortly if you haven't already. Be thinking about your goals regarding what you want to get out of your sim experience today. For example, is there a specific skill you're hoping you'll have a chance to practice today? Are you hoping to refine your nursing assessment or patient education skills? How about critical thinking, prioritizing, or teamwork? We are behind you as you discover your areas of strength and the areas where you need support for further improvement. What would make your experience today valuable? We're here to help you achieve your goals. While waiting for your facilitator, you can use the Care Connect guide to log into your patient charts and begin reviewing them. Make sure you are looking at the correct patient charts as the naming configuration changes very slightly for each patient of the same name. You should have some direction on the whiteboard telling you which patients are assigned to you. We sincerely hope you find your experience today valuable, supportive, and applicable to your practice as a student nurse and future registered professional nurse.